Action.
Holistic medicine has been gaining popularity in the last 2 decades, and many people are trying this as a way to manage a number of their medical conditions. However, they're not always sure what's medically fit or scientifically sound for their health condition. And for this kind of guidance, they turn to medical doctors with holistic training. Dr. Wendy Huang has been practicing this kind of integrated medicine in Colts Neck for about the past 8 years, and we're very happy to have her here with us today.
Happy to be here.
So, Dr. Wendy, a lot of patients just call you Dr. Wendy. Why do they only use your first name?
When I was start my medical career, I was a pediatrician. My last name, Huang, is kind of hard for children to pronounce, so they start to call me Dr. Wendy. It's kind of cozy. I like it, so I've been using it since then. And actually, if you Google Dr. Wendy in the Googles, my webpage will come up at the first page. So, so if you like it, call me Dr. Wendy too.
Okay, that's great. So, Dr. Wendy, why did you change from your pediatric practice to your current holistic and anti-aging practice?
After about 2 decades practicing pediatric medicine, I realized the current system focuses on treating the symptoms with drugs instead of helping patients to achieve true health. So I decided to look for better medicine for my patient.
Okay. The term is widely used. I see it everywhere, but could you tell us exactly what is holistic medicine?
This has to go back to the root of the word holistic. It's whole, W-H-O-L-E, which means treating the patient as a whole being. For example, before we give antibiotic to a kid with ear infection, we need to consider the possible side effects of the antibiotic on his other part of the body, and also how effective is alternative treatment. Since we consider patient as a whole, we want to give the thoughts about what causes ear infection, so we can, like a food sensitivity or allergy, so we can address the cause to prevent the future recurrence.
Okay. So how did you acquire the training that you needed to practice holistic medicine?
At the beginning, holistic medicine was not so popular, so I just learned from the practitioner from all walks of life. Sometimes Harvard Med School, Columbia Med School have conference, I attend them. About 5 years ago, I started a fellowship with the American Academy of Anti-Aging Medicine, and I was certified being the diplomats from their oral and written board.
So could you tell us, what is the American Academy of Anti-Aging Medicine?
The Academy finds new, safe, effective ways to treat most of health conditions, and also the cutting-edge medicine like stem cell therapy and bioidentical hormone replacement therapy to extend the patient's useful and productive years. They stress the importance of evidence-based medicine and scientific proof treatments.
That's good to know. What can patients expect when they visit your office?
Well, first of all, they get a lot of personalized attention. The first visit I schedule like every hourly, and then every 1.5 hours as a follow-up visit. Each patient will receive a very extensive lab work, including blood and saliva tests, and then we will schedule a very in-depth education session to go over the lab work in 2 weeks, so patients fully understand their health condition, and we form a treatment plan together. Most of the patients really enjoy this approach.
So how do you diagnose the condition differently from other physicians?
First, I order some special tests that most physicians do not order. And when I interpret lab result, I use optimum value instead of normal range. Most labs use 90 to 95% of general public's lab value to define the normal range. And majority of doctors think normal range is okay. It's probably okay, but I want the best for my patient. For example, fasting plasma glucose level, normal range is 65 to 99, but we know a lot of patients already have glucose intolerance, like insulin resistance, when the glucose level is above 90. So I use 70 to 85 as an optimum range and help patients to achieve that way. So I do a little differently.
So your diagnostic methods differ slightly from a regular primary care physician.
Right.
And how do your treatment methods differ?
I use almost all natural products, no drugs. And they're surprisingly effective with much less side effect. The natural products I use include food, herbs, vitamin, mineral, glandular product, and hormones identical to our own. And also I treat the patient, all the system together at the same time. I think it works better that way.
Okay, so you think this approach works a lot better than other, I guess, other types of medicine out there, correct?
Yeah, from my experience, I think they really work much better. And also, I think at least patients should have a choice of what kind of medical care they receive, instead of just only have pharmaceutical option.
Okay, thank you very much, Dr. Wendy, for participating in this interview. And I do feel like I've learned a lot about perhaps a subject that a lot of people aren't quite aware of. And I hope to interview you again.
Love to.
Thank you.
Thank you. Thank you for having me.